Hello there. We're going to start with some breaking news because the European Union drugs regulator says the AstraZeneca coronavirus vaccine is safe and effective. It's been investigating the medicine following reports of blood clots forming among some recipients. The EMA says it's reached a clear scientific conclusion. The benefits of the inoculation outweigh any risks. A number of EU countries, including Germany, France, Italy and Spain, they have suspended the administration of this particular drug. Let's go to Brussels and speak to Jack Parrock. Jack, safe and effective, but with a little bit of a rider from the European Medicines Agency. Tell us about that rider especially.
Indeed. So EMA Cook, the Executive Director of the European Union's Medicines Agency, reasserted the opinion of the EMA that the AstraZeneca shot is a safe and effective vaccine to be used in the European Union in all member states. They say that after this panel, there's clear evidence that that is the case. But the proviso, as you're mentioning, is that she said while they know that it's safe, they can't rule out that there is no side effects to the vaccine and that would take more and more research. This came after there were reports of somewhere in the region of about 30 reports of blood clots in people who had received the AstraZeneca shot. EMA Cook says that bearing in mind that there's 5 million plus AstraZeneca shots that have been handed out already, 50 million, sorry, AstraZeneca shots that have been handed out already, that actually that is a reasonable amount of number, and that she said there are always risks when you're giving out vaccines across the board in such large numbers. They insist that European Union member states should now trust the scientific advice of the European Medicines Agency after this panel.
OK, Jack, thank you very much indeed. Jack Parrock with confirmation there that the EU's drug regulator, the EMA, says the AstraZeneca coronavirus vaccine is safe and effective. Let's get some professional analysis from Dr. Bharat Pankania, Senior Clinical Lecturer here in the UK at the University of Exeter Medical School. Doctor, always a pleasure to talk to you. I'm not going to ask you for your reaction necessarily. You can give it if you want to, because we've spoken so often, and I know you're a massive proponent of vaccinations, and I know you would agree with the European Medicines Agency. Have people been overreacting to reports of blood clots among some recipients of this particular product?
No, and I tell you why, because these are new vaccines. And as they are new vaccines, in fact, the good message is, look, after giving you the vaccines, we have been following up and looking out for reports of unknown, unexpected outcomes in case they are related with the vaccine. And here we got unknown, unexpected reports of blood clots. Are they or are they not related to the vaccine? And this was thoroughly investigated, and it is being investigated. So that should be a reassurance to people that, look, we just don't give up after we've injected you. We follow it up and we make sure it remains safe. That is what the European Medicine Agency has been doing.
OK, as far as I understand it, blood clots come from the thickening of blood. But the EMA is also looking at reports of internal bleeding, possibly, which is called by blood thinning, correct? So can you just talk us through about possible effects of any vaccine? And they're all, the ones that are being used in the EU are all being investigated, the effects of the vaccine on blood versus the effect of the virus on blood.
That's very important. So there is just speculation at the moment that could the vaccine also cause what we call thrombocytopenia, which means basically your blood platelets disintegrate and you have a very low platelet count, and that debris equals the clots. So you got clots because your platelets, the clotting thing, has gone, and you've now got thinned blood, but you've got the debris, and that's the clot. Now, the important bit is it's speculation. We think it is probably a coincidence because we had a few reports of DIC, as we call it, disseminated intravascular coagulation in Germany. Having said that, on the other hand, if you were to get COVID disease, we know for sure some people with COVID disease do go on to have multi-organ affection and multi-organ problems, including blood clots. So if you were drawing up a balance, what do? Do you take the vaccine or do you get COVID? And my emphatic answer is take the vaccine because on balance, the risk is very low compared to the risk with COVID-19 disease.
Do you see any point at which, if countries were able to, they might present patients with a choice of which vaccination to have? Or do you think that every single dose of a vaccine is so precious that countries will never go there?
No, every single drop of any vaccine that has been licensed is very precious. And whilst we have got the spotlight on AstraZeneca Oxford at the moment, there is nothing to tell us that Pfizer may not have similar headaches. I personally believe that these are coincidences, and AstraZeneca Oxford just happens to be caught in the spotlight. Any vaccine which is new has to be observed and looked for side effects. We don't think Pfizer or the AstraZeneca one are unsafe vaccines. They both protect you from COVID-19 disease.
Dr. Bharat Bankania, as I say, thank you so much. Always appreciate your analysis. Take care.